Dr. Dineen for this evening's Integrative Insider Live. Thank you.
Thank you so much, Dr. Hecht, for the warm welcome. I am going to share my screen here. So today we will be talking about a little bit of exercise as it relates to the heart. And so we will be talking about some evidence and hopefully some helpful tips to get us all into healthy exercise, and time for questions at the end as they mentioned. And so today's outline, we will be understanding the benefits of exercise for heart health, reviewing exercise recommendations to maximize cardiovascular benefit, illustrate practical ways for designing an aerobic exercise program, do a quick review of exercise recommendations with people who have known heart disease, and discover potential risks of extreme exercise. So, as we dive into the benefits, we all know that there is a huge mortality benefit, or we live longer if we're more mobile and exercising. And so, the top chart shows us that as the amount of exercise or physical activity increases, the mortality drops quite a bit. There is a certain point at which the kind of bang for the buck, as much exercise as you're doing, plateaus a little bit, but this is at around 40 to 80 MET hours per week. And so if you're doing something that is, say, 2 metabolic equivalents or 2 METs, and then you're doing it for 1 hour a week, then you're doing 2 MET hours. And so if you get up to 40 to 80 MET hours per week, you're doing something that's quite a bit of METs and for a lot of hours. So to get to 80 MET hours, you might be doing an activity that is 8 METs per activity for 10 hours per week. So that's quite a bit. And we'll get into a little bit about some examples of these activities as well to kind of break down the METs. And we also know that there's improved mental health, and decreased depression, decreased mental health burden days over the course of exercising more frequently, as shown in these two bar graphs here. Stress, as shown at the top here, plays a huge role in how it impacts our cardiovascular health. And so stress increases the sympathetic nervous system activity, and it decreases the parasympathetic nervous system activity, which it leads to increased myocardial ischemia, or decreased blood flow to the heart, ventricular arrhythmias, which if long lasting, are not life sustaining, and then decreased heart rate variability as we think about as we are more fit aerobically, we have a wider range that our heart rate will go to. And so, from a neuro standpoint, we decrease stroke risk, improve cognitive function. From a musculoskeletal standpoint, we decrease falls, decrease osteoporosis, especially with strength based weight bearing exercise, decreasing cancer risk, improving weight, decreasing diabetes risk, and cardiac, we talked about a little bit, including improved blood pressure and decreased risk of coronary artery disease. And so, as we think about the exercise recommendations, this diagram is from the American College of Cardiology primary prevention guidelines that were updated in 2019. And these are some core tenets of preventive cardiology and preventive health in general. And so, today's talk is really about the exercise piece, but it's important that we're doing and focusing on all of these avenues to improve cardiovascular risk as well. And so the thought is that we would do at least 150 minutes per week of a moderate intensity aerobic physical activity, or 75 minutes per week of a vigorous physical activity. And we'll get into what that means as well. And these are just the recommendations as shown on health.gov. And really, if we could do the aerobic piece as well as the strength training and some stretching, we're getting additional benefit as well. And so if we think about the exercise program components, it doesn't necessarily have to be, running or cycling, anything that we're purposefully doing during our day to increase our heart rate and increase the aerobic and cardiovascular benefit can be exercise. And so in the top here, we have cardiorespiratory exercise or aerobic. And so these are some examples, and you could do 7 days a week of moderate intensity. You could do a couple days a week of vigorous intensity, where you're getting your heart rate up to 80 or 90% of predicted. And so as we mentioned, the moderate intensity can be really any activity. It could even be a brisk walk, something that we talk about to just feel like you're having a good workout and increasing your heart rate, but that you might be able to have a conversation during. And so we think maybe on average 30 minutes a day is a good goal, because the 150 minutes recommendation is really the minimum. And so as we talked about at the beginning, there's improved health benefits as we exercise more. Flexibility helps us to stay in a healthy, non-injured state. And so a couple days a week of stretching. It could be yoga or it could be purposeful stretching related to whatever activity you're doing, just making sure that we stay flexible. Strength training is also important for overall health, and there's different suggestions that you can get into as far as max reps or percentage of max amount that you can lift, how many reps that you want to do. But we're not really getting into all of that detail today. From a neuromotor standpoint, it could be quite helpful as we get older to do things like Tai Chi or other balance activities a couple days a week, and that improves mental health and also improves fall risk. And so things that are associated with different intensities are those MET equivalents that we were talking about. I've labeled what is considered moderate intensity is about 3 to 6 METs. So in the graph here, or the chart here, you can see even general house cleaning, walking briskly, or even things up to strenuous hiking or rowing. Or I guess the rowing they say might be in higher METs. I guess it depends on how intensely you're rowing. But as we get into the high intensity or vigorous intensity exercise, it might be around 6 metabolic equivalents, or a little bit more than that. And so downhill skiing, resistance training at higher intensities, swimming, some of these things. So as you categorize your activities, you can see where you are. And so the metabolic equivalent is the energy expenditure for sitting quietly. And for the average adult, as it says here, that's about 3.5 milliliters of oxygen uptake per kilogram of body weight per minute. And so then a 2 MET activity requires 2 times the metabolic energy expenditure of sitting quietly. So as it says here, and that's kind of the activities that we talked about in the prior slide. You don't have to necessarily go based on METs to say if you're doing moderate or high intensity exercise. Some people go off of the Borg scale, which is the rating of the perceived exertion. And so it's been around for quite some time. Some people go off the modified scale, but what's important is that we see the green or somewhat hard to hard. That's considered more moderate in activity, and things that are considered very hard or very very hard are really vigorous or kind of your maximum output. We can also decide how intense our activity is based on heart rate. And so a lot of people probably know the maximum predicted heart rate equation they do for stress tests, treadmill testing, 220 minus age. Some people think that the equation below it is a little bit more accurate, but I'll take you through an example that shows that it gets you to a pretty similar target. So if we are 55 years old, if we take 220 minus age, we get to 165 beats per minute. If we take the other equation, we get to 170 beats per minute. So it's really just an estimate to then help you get a target of moderate intensity or high intensity exercise. So moderate intensity being about 60 to 70% of maximum predicted heart rate. So in this example would be between about 100 to 120 beats per minute. or higher intensity. Some people use a cutoff of 80% of max predicted heart rate. Some go a little bit higher to 90 or 95%, and that's to about 145 to 160 beats per minute. And there's not necessarily an absolute cutoff. These are targets for guiding your exercise intensity. And so, as we make our exercise goals, depending on where you are in your exercise journey, hopefully they're SMART goals, being specific, measurable, achievable, result focused, and time bound, to really help us see results. And there's different tools out there to help make an exercise program. This is one example from health.gov, and you can say what you want out of your exercise, what be it feel less stressed, be a role model for my family, have fun, etc. And you can click the different activities that you want in your exercise plan and work through that to have something that guides you throughout each week. A lot of us have these wearables or fitness trackers. I've just shown a couple examples here, depending on what's helpful to you to log your exercise or compete against friends or family members. We've got Map My Run or Map My Walk that I've shown here on the right, which is an app-based program. We also have the Polar heart rate strap up here, or tons of different heart rate straps you can use to monitor your heart rate. We have the Whoop band and the Aura ring, and so all of these things tell you different health outcomes, whether it's your sleep or how much you're recovering, and different metrics about your heart rate as well. And then I've got some other smart watches on the left. But whatever works for you in tracking, there's not necessarily one best digital or wearable device. I think whatever gets you to your goals and targets and helps you monitor accurately. I will say that if you're running or doing something where you're mobile, the heart rate strap is considered to be more accurate than just the wristwatch for measuring heart rate. And so for exercising with heart disease, really, if you have anything that's concerning to you, but also things like chest pain, diabetes, a diagnosis of high blood pressure, high cholesterol, a prior heart attack, heart failure, and others, then before starting at least moderate to high intensity exercise program, really it's helpful to talk to your medical provider. And a lot of people could benefit from a stress test, getting on a treadmill or a bike and pushing yourself to max in a controlled setting. And sometimes that gives people the confidence they need to do an exercise program, but it also might uncover some coronary artery disease or heart rhythm problems that should be addressed prior to, especially doing something like a high intensity interval training exercise program. Some people do benefit from cardiac rehab, and it's covered by insurance for certain diagnoses, like if you've had a heart attack or a stent, if you've had valve surgery, and there's a couple other things that qualify, but it's a supervised exercise program for 12 weeks, 3 times a week, usually for an hour or 2 hours. And the focus is really ramping up an exercise protocol while you're being monitored with blood pressure, heart rate monitor, and other things. And then usually in most programs, there's teaching about nutrition, stress reduction, stop smoking if that's applicable, and then talking about the medications that you've been prescribed, and communicating then with your medical provider as well. And there's huge benefits for cardiac rehab. Really, this is just the same benefits that having a regular exercise program has, but there's data that shows that it decreases risk of another heart attack, reduces overall mortality, and people usually have less chest pain episodes, as well as the other benefits that we know from regular exercise, like lowering blood pressure and cholesterol. So, for people who are doing extreme exercise, there is this extreme exercise paradox or hypothesis. And so, this graph shows us that that nice curve of benefit as your exercise training is increasing, and there is that plateau. But what that first graph didn't show us was the potential riskiness of extreme exercise. And so we showed that 80 met hours per week, doing something that's 8 mets, 10 hours a week, or more is sort of where it plateaus, or maybe even 120 met hours. So we're talking about quite a bit of exercise at quite high intensities. So this doesn't apply to a lot of people. But for some of the people that it does, there is an increased risk for atrial fibrillation. Some people have more plaque in their arteries or coronary artery calcification. And some people have been shown to have some kind of stiffening or thickening of the heart muscle or fibrosis over time. And so that's often with more of our endurance athletes, marathoners, triathletes, and people that are doing a lot of these races and training. And so this is just a picture of what coronary artery calcium looks like in the artery. As you can see kind of in the front of the picture, almost where it's cut off here, that's actually bone, that's white, that's calcium. And so if we look to the cross section of the heart here, this white plaque it should not be in the heart arteries, and so that's calcium, and we can measure that and assess risk based on coronary artery calcium scores, and help guide exercise planning and also cholesterol targets. Atrial fibrillation, one of the most common heart rate issues, where we have an irregular heartbeat that increases stroke risk because of the nature of the arrhythmia. And so there can be an increased risk with some people with extreme exercise. There's a lot of controversy about this because exercise has huge benefits. And this is not to say that people should not exercise or do some of the training that they love. It's just kind of going into it, acknowledging that things might happen, and we're still learning about it as a medical community. So, this slide here shows some of the theories and some things that have been proven about why coronary calcium happens in athletes. And so, they're thinking about maybe there's increased inflammation, a diet that might not be as healthy potentially. Maybe there's genetic predisposition, there's mechanical stress, and other things that happen during exercise. And so, not all of these are proven, but it's things to consider as research continues. And then the same thing with atrial fibrillation. There is some data to suggest that with endurance athletics, sometimes there's more remodeling of the heart, stretching of some of the heart chambers that can kind of stretch the electrical circuit and predispose to atrial fibrillation. There's other changes that have been proven as well, and some that are still being studied. And so as we kind of go back to the first graph, there really is quite a significant benefit with things with physical activity, and benefit way over the at least the baseline recommendations from the CDC and other governing bodies telling us how to have a healthy life in general. And again, that same chart here, just bringing us back to the benefits of exercise. And so, just quickly today, we have talked about the benefits of exercise for heart health. We've reviewed some exercise recommendations to maximize cardiovascular benefit, illustrated some practical ways for designing an aerobic exercise program. We did a quick review of exercise recommendations for those with known heart disease, and discovered the potential risks of extreme exercise. So, with that, I'd like to thank you, and I will turn it back to our hosts for some questions.
Hi, everyone. Um, so we have in the Q&A, I have some questions. For patients that want to develop more muscle mass when they're exercising, I know a lot of athletes will take supplements, but are there any that you recommend in general?
So, I think they're asking maybe about bodybuilding, or hinting at it potentially, um, or something short of that potentially if it's not competitive bodybuilding. But I don't actually recommend any supplements to increase muscle mass. I think the the heart of what's important is to do the cardiovascular aerobic fitness, strength training, and then also just eat a really healthy, well balanced diet. We talk about the Mediterranean diet having kind of the tried and true. Heart health benefits. It's not a blanket statement for everyone. So some people are going to have different health goals about what they want from a performance standpoint. So if you're trying to do more strength activities, meeting with a nutritionist to kind of hone in what you're focusing on, be it increasing your protein in your diet, decreasing refined carbohydrates, but really falling back on the Mediterranean as a backbone. So lots of fruits, vegetables, lean meats if you're eating them, fish, omega 3s in the diet. But I don't really endorse any supplements for sort of muscle mass building or bodybuilding.
Are there any dangerous supplements in your opinion that people have been taking?
Yeah, that's a good question. I there's a lot of controversy, I suppose, about hormones, and I think people should. The data that I've seen is, if people have deficiencies in certain hormones, then regulating those and kind of getting those back to a normal homeostatic balance of hormones is good. I don't think people should take necessarily extra hormone therapy. Um, Unless there's a medical reason, um, for symptom relief or something like that. Um, Stimulants. So I don't think people should be taking. Sometimes it's a little bit dangerous when there's too much caffeine, and there's a potentially healthy amount of caffeine. It's not necessarily something that we prescribe, but I know a lot of workout mixes and powders have caffeine to help people kind of give an extra jolt to their workout. Sometimes those can lead to dangerous rhythm issues. And if you could imagine, if you have underlying coronary artery disease, and you're really pushing your heart rate, and the sympathetic drive of caffeine, sometimes we've seen some detrimental effects of that.
Thank you. One of our attendees has asked, what is a good supplement or drink to hydrate then and help with muscle soreness after an intense weight workout or weight training?
Yeah, so that's a good question. Um, Without endorsing just blanket statement, that I don't have any financial benefit, I suppose, with any supplements from that. But a lot of people I've seen use the Noon or Nun tablets, NUUN, or just something that has electrolytes in it and not too many calories. So, Gatorade has important electrolytes in it, but it also has a lot of sugars and calories. So I think different electrolyte tablets can be helpful. Some people will eat the gel packs to help with recovery or during a long training run, that have helpful carbohydrates, that can replenish you during your exercise. And I would try and go as natural as possible with those so that you're not getting a lot of the corn syrups. I don't think many of them have saturated fats in them, but I would just be as natural as possible to try and get just the basic electrolytes and fluids and things that you're hydrating with.
Is there any concern, Dr. Dineen, like if a patient is on like a blood pressure medication, like a spironolactone that's potassium sparing or anything like that, or some other blood pressure medication that's a diuretic?
Yeah, so that's a good question. When people who are athletic and they have blood pressure, we try to steer clear of too many diuretics, and so it's something to talk about with your medical provider who's treating your hypertension, because if there's a better agent to be used that wouldn't dehydrate you as much, so hydrochlorothiazide, sometimes try and steer clear of if someone's really doing a lot of exercise, especially endurance athletics. Spironolactone doesn't dehydrate as much, and I think if you're on any of these medications, taking it every day, your body's going to have adjusted, and you're going to be adjusting with your regimen. Some people benefit from spironolactone if they have heart failure and other things, and should be on that medicine. And if that's the case, I think just there's different doses you can start at, and so you could start lower, and ramp up to max dose if needed.
Thank you. I have a lot of questions on here. If your
Oh,
child
great.
has a heart murmur, but it's closed, is it still a concern for exercise?
So that's a good question. A lot of people were told as infants or as kids that they had kind of a heart murmur. A lot of those murmurs aren't actually related. I don't know in this specific case, but a lot of them are not actually related to like an underlying heart condition. Without having an echocardiogram or ultrasound of the heart, it's hard to say just based on physical exam. Heart murmur doesn't necessarily mean there is something. But in this case, if they did have an ultrasound of the heart and they found something there, then certainly getting follow up for it. There's all different types of things that can cause murmurs in kids and adults. So a lot of people will just do a follow up echo. Um, but if it's just based on a murmur, the likelihood of it, and if it's gone now, it may have just been something related to like a flow murmur or something during that exam.
Great. Um, Another individual asked, how much exercise is too much for someone in their 50s?
So there's not a too much based on an age cutoff necessarily. There's people in their 90s running marathons. It just depends on kind of what your level of fitness is and what your fitness goals are, and then your underlying health conditions. And so I think if someone has high blood pressure, diabetes, some of those other things we talked about, or if you haven't started an exercise regimen, probably talking to your family doctor, your internist, your cardiologist, or someone to see if you should get a stress test first. But there's not necessarily a specific cutoff based on age alone.
Great. I think that answered another person's question of, do these exercise guidelines change with age? And it sounds like it's more dependent on their general overall health.
Correct. And there's a little bit more focus with age on sort of the neuromotor exercises as well, sort of Tai Chi or other balancing exercises, and making sure that there's really strength training and flexibility. So just really a well balanced exercise regimen if possible.
Okay. Another participant asked, like, how can you tell if you have heart inflammation and what are the signs?
Hmm. Yeah, I mean, it's a pretty hot topic these days with thinking about myocarditis or inflammation of the heart muscle, especially in the age of COVID and the COVID vaccine and everything. Um, you know, if that's kind of what the question is about, there's been a lot of data out there where, if you've had COVID or some other virus, or you don't even know if you've had it, really symptoms. So, like the question is asking, symptoms to look out for would be just typical symptoms of kind of any cardiac issue, but chest pain, sometimes just overall fatigue and not being able to do as much exercise as you used to. Um, sometimes people get short of breath with exertion. Maybe you used to be able to run a mile at a certain pace or walk a mile at a certain pace, and now you're really having trouble getting there. That's not just muscle or heart inflammation. It could be anything, cardiac or non-cardiac. But those are some symptoms to look out for. Um, if you have inflammation around the heart, sometimes people have shortness of breath or chest pain when they take a deep breath in, and sometimes they feel better sitting up actually and worse laying down, interestingly, and it doesn't necessarily relate to exercise. So you can't necessarily tell when you have heart inflammation, but I think it's important to just look out for the overall symptoms and then seek medical attention if you think you have a concerning issue.
Great. And then this one, I think you kind of addressed in your lecture, but it would probably be good to go over again. If you have a heart rate monitor, how do you know what your target heart rate should be during your workout?
Hmm. Yeah, so good question. So it depends, I guess, on what intensity workout that you want to do. So if you're aiming for a moderate intensity workout, then aiming for about 60 to 70% of your max predicted heart rate would be a good goal. It's not you don't have to be exactly 60 to 70% of your max predicted. It's kind of a moving target. And then if you want to do high intensity training or vigorous intensity, some people use a cutoff of 80%, some people use 85% or higher of sort of that max predicted heart rate. And so easily you can just do 220 minus your age to get to what you think your max predicted heart rate might be, and then take 60 to 70% of that, or 80 or 85% of that, and use it as kind of a rough target. And kind of the pole or the any of the heart rate straps, the chest straps, are a little bit more accurate, or quite a bit more accurate, the studies have shown, to monitor heart rate if you're being really specific about it.
So if you exercise and it's not controlling your blood pressure, which was recently diagnosed, what is your approach to helping patients find the right medication balance with exercise to control blood pressure?
Hmm, good question. And I'd my overall approach is to try and figure out a root cause for the high blood pressure also, which I assume has probably already been done, hopefully, or working on doing that, if medications needed to be started. So I actually first start with diet. If you reduce salt in your diet, your blood pressure comes down markedly, especially if you're a high salt person to begin with. The exercise helps. Some people have sleep apnea that's actually not diagnosed. And so going for a sleep study if you're waking up tired or you snore at night. Because if you have low oxygen to your brain and your heart and everything at night, that it increases cardiovascular risk and also decreases our ability to control blood pressure. So controlling sleep apnea helps. Looking for undiagnosed, anemia or thyroid issues, kidney disease. So alcohol, you don't want to drink alcohol in excess because that can make blood pressure go up, stress. So there's just a long list of things. Some people take non-steroidal anti-inflammatories, so actually more like Aleve or Advil. So if you're taking that chronically, that can raise your blood pressure. So if you've done all of these things and you're on medications, then sometimes with someone who's an endurance athlete, I might start something like lisinopril or losartan. So I often don't go for a diuretic or a beta blocker, but might go for one of the other medications.
That's wonderful. I have a question kind of related to that is what do you think about looking at general endothelial dysfunction and when do you like to examine that in patients versus, not?
Yeah, that's a good question. That also reminds me that I will sometimes recommend L-arginine as a supplement for blood pressure, given that it's the precursor to nitric oxide and helps to vasodilate. So sometimes we can do that from a natural approach. It's not highly effective as many of the prescription medications, and sometimes magnesium can help. But endothelial dysfunction, or like with the endopat study, I've been ordering it more frequently in people who have been diagnosed with like microvascular coronary disease. So say you go for a coronary angiogram, or otherwise known as the left heart catheterization, and they find that you have plaque in your arteries, but you don't need a stent. But maybe you had an abnormal stress test, or you have chest pain, or something like that. Often we'll diagnose that with microvascular or small vessel disease. And we treat that very similarly to coronary artery disease, but it's sometimes really helpful to know from an endothelial standpoint, with the endopat, for example, to see. if that's abnormal. Some people with blood pressure that we're having trouble controlling, sometimes they'll go for an endothelial dysfunction study. And sometimes if people are having headaches as well, because some certain medications can help vasodilate. And I find that helps a little bit more when there's some underlying endothelial dysfunction.
Great. I have three more questions for you.
Great.
What what is the best strength training exercise in your opinion, and or the best cardiovascular exercise?
So I think it's probably the one that will be done most regularly, really, because everyone has something different that they enjoy doing. Some people only want to do the elliptical, or they only want to play soccer, or pickleball, or swim in open water, and so. Whatever sort of gets you out of bed or gets you to the gym or gets you wherever working out is honestly the best exercise. And so I don't mean to be annoying and answering the question that way, but there's not a best cardiovascular exercise. Now, people who love running, you might have more osteoarthritis problems when you get older because it is such an high impact activity, and some people transition to the bike or to swimming or something that's lower impact on the joints. Some people tolerate it fine and don't ever need injections or other things for their knees and hips. Strength training. I don't think people need to be maxing out with strength training. And certainly, if you have any issues with your aorta, or really high blood pressure, I would kind of steer clear of trying to do max strength reps, and instead I do it for endurance. So you do like maybe 60 to 70% of your max rep, and do maybe 8 to 12 of those instead of 3 to 6 or something, and do a lot of reps, something that you can do that you're not fully maxing out. And the reason that you wouldn't want to do that with high blood pressure or aorta problems is you don't want to bear down and valsalva and hold your breath, because it just increases your blood pressure way too much in that exact moment. But short of that, just anything that gets you exercising, I think, is the right exercise to do.
Great. And are you familiar with gyrotonics? This question is, has the Samueli Institute explored considering offering gyrotonics because it checks all the boxes for mobility and strength?
Oh, interesting. I would have to look it up. So, to my knowledge, we have not, and so it sounds like something that we could definitely look into, or potentially recommend, if we're saying that it checks all the boxes for physical activity.
And the last question, which you partially addressed, was what food or diet plan do you recommend? And do these recommendations change with age? And you had mentioned, oh, maybe decreasing sodium or like a DASH kind of diet might be helpful for reducing blood pressure. But do you have any other dietary or, recommendations?
Yeah. So, I often well, it's diet is so personalized, right? And so a lot of people will have food sensitivities or cultural preferences and different things. So I think kind of understanding the baseline and food preferences there of the family or the individual is a really helpful starting point. And then I do think there's so many different diet studies out there and research. But the tried and true one is really sort of a Mediterranean diet focus. And so doing things that are high in fruits and vegetables, and decreasing refined carbohydrates, so steering clear of kind of white rice, white pasta, white bread, and going to more whole grains, or even replacing those with legumes, beans, quinoa, healthy proteins. It's okay to eat meat, but if you're choosing that, then leaner cuts of meat. Um, Things that are high in omega 3s are really helpful for cardiovascular health. Salmon, almonds, walnuts, olive oil for cooking, steering clear of saturated fats. So that's sort of, an overall dietary suggestion. And it changes a little bit, mostly based on individual preferences or sensitivities, and then sometimes to underlying disease process. So if some people have triglycerides that are a couple hundred, 500, maybe 600. They really should be eating a very low fat diet. But short of having triglycerides that high, I don't always recommend, you know, really low fat diet, for example.
Great. Well, you've answered all of our participants' questions. Is there any final words of wisdom from you?
Let's see. So, oh, it looks like one might have popped up.
Oh,
I'm just reading it real quick. Blood pressure diastolic in Entresto, but blood pressure drops to 96/69. Um, I see. Yeah. So for this last question, it sounds like this is something where you might want to um, talk to your cardiologist about this. You know, people can have lower blood pressure readings. But things we look out for with exercise are if you're lightheaded, even before you start, certain primary care doctors or cardiologists and other people will have different holding parameters for blood pressure. So I would revisit the pressure conversation with whoever prescribed those to you to see if they want you to hold. Usually we say to hold your blood pressure meds if your blood pressure is less than 90 for some people, especially if you have heart failure, and some people use a cutoff of 100. So that would be my overall, without kind of knowing more clinical background, my suggestion there. But yeah, parting words are just I'd be happy to chat more with anyone about exercise and cardiovascular health. It's a big passion of mine, and I think any exercise that you do, as we talked about, is probably something that gets you moving most days of the week. Is just super important, as the data shows. And there's the people that are having the extreme exercise examples, really, I think still the benefits of exercise often outweigh those risks that we talked about. So that's all I've got. But thank you so much for having me.
well, thank you. Have a good evening. Let me see if there might be some things that I have left to say before we part. If you'll give me one moment.
And there's one other question. Do we need a prescription from our primary integrative doctor to come see you? I think that people generally get some sort of referral. Dr. Heck, do you know the answer specifically about that?
If you have a PPO, then no. I think like if you have general Medicare, then no. But in general, it is good to have a referral. But for patients that have PPOs, they don't need to have a referral. And then I do have a few closing remarks that I'm going to pull up really quickly. Thank you so much, everyone, for joining us for our Integrative Insider Live community lecture. At the end of this webinar, a pop-up window will have a valuable survey on this evening's event that we hope you fill out. So please help us improve our community offerings by letting us know what you think. We'll also be emailing 5 key takeaways from this session to the email provided at registration. Lastly, we're very excited to launch an Integrative Insider Live summer series for our Mind, Brain, Body Wellness program that will be launching soon. And on Wednesday, July 14th, we will welcome the Director of Mindfulness Program, Dr. Jessica Drew DePaz. She will explore evidence-based strategies to cultivate our well-being through mindfulness and psychotherapy. And then on August 5th, we'll host Dr. Christine Krause, our neuropsychologist, to discuss services such as the neuropsychological assessment, including brain mapping, neurofeedback, and enhancing performance sports training. Dr. Darlene Lee will wrap up the series on Thursday, September 23rd with biofeedback, including her recent research studies on stress and the impact of community-based biofeedback on drug use and mental health among people experiencing homelessness. More information on how to register for our events are on our website at sssihi.uci.edu. Thanks again, and we'll see you next time.